Elizabeth Blackwell never even dreamed of becoming a doctor until a dying friend said that she would have lived longer if she had a lady doctor. Elizabeth Blackwell was born in Bristol, England in 1821 to Samuel Blackwell and Hannah Lane. Elizabeth Blackwell was the first woman to become a doctor. She received her MD at Geneva College in New York in 1849. After applying to 50 other different colleges, Blackwell finally got accepted, but only by a student vote. The students who studied at Geneva thought the idea of her applying was a joke, so they all voted yes to be funny. So in 1842, she started her journey and moved to upstate New York. At first, the men thought it was strange to have a lady sitting next to them during a lecture, but then they broke the ice and befriended her while she befriended them. She graduated in 1849. She needed clinical practice, so she worked as a doctor at the local poorhouse. After spending a year there, she headed off to Paris to work at La Maternité, an infirmary, because Florence Nightingale, an old friend who worked as a midwife at a local hospital, said that Elizabeth should become a midwife and study gynecology. So in 1852, Elizabeth moved from New York to La Maternité, a midwifery in Paris, France. A fellow doctor whom Elizabeth met was a man named Hippolyte Blot. He taught her everything she needed to know about gynecology. One day when Dr. Blackwell was fixing a baby's eye infection, Elizabeth accidentally splashed the medicine in her own eye. After a couple of hours of thinking her eye was fine, it started to hurt and swell. Suddenly she realized that her left eye would not open. Doctors finally had to remove her left eye and replace it with a glass one, which left her blind in her left eye for the rest of her career. This ruined her dream of becoming a surgeon. By looking at the life of Dr. Elizabeth Blackwell, we can see that she helped women's rights in medicine. This is important because today women can work in a field that used to be all men. Dr. Elizabeth Blackwell had some major accomplishments. She opened her own hospital for women and children because no hospital was going to give her a job with blindness in one eye, and plus she was a woman. She started with a clinic in downtown New York for poor women and children, but she didn't have many customers. Since Dr. Elizabeth Blackwell still rarely had patients, the clinic moved to the poor part of New York City, where she had more customers. There were so many patients, so in 1883, she opened up a hospital for women and children. Along with having her younger sister, Emily, a woman trying to receive her MD, became the hospital's surgeon. At the hospital's peak, it had 866 patients, and 266 needed hospitalization. The staff was mainly unemployed midwives who knew medicine as well as midwifery. Dr. Blackwell wanted to expand her knowledge even further, so in 1892, she opened up a medical college next door to her hospital. She was the first to ever accomplish that. Her college consisted of all women professors. Now, Emily and Elizabeth worked part-time at the hospital and part-time at the college. Elizabeth's college only accepted the best and most driven young women who dreamed of becoming doctors. The future women doctors had to complete long essays and attend lectures. At the college's peak, it had 231 students. By examining the career of Dr. Elizabeth Blackwell, we can see that she empowered women in the field of medicine, which is important because there used to be no women doctors. She gave women jobs in medicine and let women go to college. She also established better medical care for women with women doctors. Dr. Elizabeth Blackwell is the true definition of a person who shaped our world.